Firstly, let's look at some of the savings you still reckon can be identified within the welfare system. What are they?
Well, we are backing the federal government effort to get rid of the senior supplement, which is a supplement that the Howard government introduced during the boom years for people who already have too much to receive the age pension. We do think that can go. The extended Medicare safety net, now that was introduced during the Howard era as well. It was designed to reduce out-of-pocket expenses for people in the health system, but all the evidence is showing that it's regressive. So what it's doing is helping people on higher incomes more than people on low incomes. It's not doing the job that it was originally intended, and it's costing a lot of money. And the private health insurance rebate, introduced 1999, meant to be helping to reduce the pressure on public hospitals. All the evidence is showing it's not doing that. So we don't actually see these as radical proposals. What we're saying is we've had time to look at these measures, the evidence is there, that's what we need to be doing. Obviously, we want the government to take a much fairer approach to the way it looks at the overall budget settings, how we get back to surplus in the right way, and obviously tax is a big part of that. The tax loopholes, tax expenditures, which are actually valued at over 120 billion all up, which is over a quarter of the impact on the budget. So it's a big part of the story, and at the moment we haven't got the government prepared to even talk about it.
I'll ask you about how discussions are going with Scott Morrison a bit later on, but firstly back to that private health insurance rebate. As you probably know, it's not just enjoyed by wealthy Australians or even those who are moderately well off. Do you fear, though, that pulling it back even further will hurt more families than it helps, especially at a time when private health insurance premiums are about to go up and go up fairly highly yet again?
Well, this is part of the problem with what the government has been successfully doing, which is trying to deliver on affordable healthcare by bolstering up the privatised approach through a private health insurance rebate, rather than looking at reform through delivery of Medicare available services. We've had this big debate about, what should happen with GPs and bulk billing. The public is saying they want to have universal healthcare. Primarily, we think that should be delivered through the Medicare system. So obviously, our proposals about what we should be rolling back on is about pulling back on spending. Of course, there's a bigger debate that should happen about reform of the healthcare expenditure, and we would expect to see some effort to make sure that there is greater access to public health. But the point of our proposal is the rebate has not delivered on reducing pressure on the public health system anyway.
You're talking about wanting to reform negative gearing. Now, this comes up, and certainly in your submissions and from others ahead of every budget time, and no government has been politically courageous enough to even contemplate this. If it was seriously looked at, though, how beneficial would that be to repairing the budget bottom line?
Well, look, if the government is seriously listening, it should be at the point of saying it recognises negative gearing arrangements have to be reformed. Conservative economists have been talking about this for some time now. We know that we have a pressure upwards in the housing market. A lot of that is being fuelled by professional investors. That's because of how tax effective the arrangements are around negative gearing and capital gains. And of course, it's having a negative impact for people who are just trying to buy into the property market to get a home. So it's not delivering on a public policy imperative, which is about improving affordability of housing, and it's a big part of the leakage out of the tax system. So overall, what we're saying is the personal income tax system, we need to have better integrity in it so that people are contributing according to their fair share. And some of these tax arrangements at the higher end, in terms of investment arrangements, are essentially about reducing tax bills and not delivering on, really, for example, new supply of housing. The bulk of negative gearing is going into existing property. Similarly with superannuation, we're not getting where we need to be with the tax concessions there, 40 billion in value. Most of that's going again to the high end. So look, these are not radical proposals. We've done a lot of work on this. We've widely consulted. We've been talking to some of the other think tanks out there. The Treasurer was saying, well, if you don't like what we did last year, what's your alternative? And that's what we're presenting today.
Now, Scott Morrison is still fairly new to the portfolio. He's been at the job for, I think, just less than a month. Have you had any consultation, any meetings with him yet?
Yes, we have had our first meeting with the new minister. He was definitely in listening mode. We certainly said to him that the government had made the wrong decision about a major cut out of vital community services, over $250 million, which was all announced just before Christmas. In fact, on the day that he was being sworn in. We're waiting to see what the minister will do with this, and obviously also to have a proper debate about the welfare expenditure. When you talk about where the growth is in welfare payments, the truth is, if you're prepared to talk honestly about the data, we've got less money going into the unemployment payment than should be there. It's actually less than it was a decade ago, but the real growth is in the part age pension. So that's why in our budget proposal today we're saying we need to go back to pre-2006, when the Howard government opened up, but through making the asset test even more generous, access to the part pension. That's where we should be starting to taper back.
Cassandra Goldie from ACOSS, thank you very much for your time this morning.
Thank you.